And good morning. Happy Monday to you. Hope that you had a wonderful weekend. And for many of you, the end of spring break and them kiddos are back to school, and you're probably celebrating this Monday morning. All right. I am Harlan Pickett. I'll be your host for the Kickstart today. We're going to go ahead and do our 30-second countdown, and then we will get this show on the road. Thank you for being here today. All right, and good morning. It is great to have you with us today. My name is Harlan Pickett. I am the president of Eagle Care Health Solutions. I have been in this industry for about 20 years, have learned a lot, have made a lot of mistakes. And one of the mistakes that I made was not keeping up with the pulse of my industry for a number of years. Once I realized that understanding what was going on could help me be a better advisor and consultant to my clients, then I have dug in deep and have been doing it for a number of years. In the last couple, I have decided that it is now my duty to share that with you to help all of us become better advisors so we can lead the revolution into offering new and better health plans to our clients. So that is why I do this. I believe that it is really part of my journey to help others understand that there are better options out there, but you got to know what the problem is and you got to know what the industry is doing to be able to understand that. All right, we're going to jump right into this thing then. One thing I do want to point out is you can put in your questions or comments in the chat. If you do that, then we'll be able to answer those as we move along here. Or we may, depending on what they are, we may wait till the end of the event to also look at that. So once again, thank you for being here, and away we go. All right, we're going to talk first of all about something I think many of us see, but we don't realize the depth of how big an issue it is in many cases. But a new study came out, and this study was by Patent. I don't know. I can't say it right. Anyway, it's talking about workplace Americans. Okay, so these are folks that actually get their insurance through their employer. In over a 6-month period of time, they interviewed literally thousands upon thousands of people to find out what was going on with their workplace insurance. We hear these numbers and it is startling, but I believe that in this one, they asked the extra questions that helped us really pinpoint that it's not just who we may think it is. A majority of these folks that respond to this actually made more than the average American. So that means that their income was north of the 54-ish thousand that the average American makes. That is then very telling about the issues that were going on there. Another thing is 1/5 of those that were responded to the survey actually made more than 100,000. So these folks, what we would think as a society is they are very, very well off, and they should not have the issues that we're going to talk about here in a second. And then 46% of the folks that responded actually had managerial of some type. They had some type of managerial position that, once again, means they're a little bit higher up that food chain. You would not expect some of the issues that are going on there. The big problem there is that most folks are unable to afford some of the medical things that they need. One of these is because they had to reach their deductible. In many cases, they had to reach a deductible before anything would be paid for. And so this study pointed out that about 69 million Americans that have workplace insurance did not meet their deductible in 2023. So because that happened, 40% of workplace insured Americans delayed care due to how much it would cost them. And sometimes that cost wasn't even a lot, we would think, but it could be to those. But I thought that the one thing I really liked about this survey also is they broke it down to, well, what did they delay? What did they not do? 32% actually delayed their regular visits and checkups. That kind of goes in with the number that says 61%, totally different survey, but 61% of Americans don't go to the doctor unless they're sick. So there we go. That kind of falls in with it when 32% are saying didn't get my regular visit or checkup. Now, remember, on these sponsored plans, they should be covered 100%, right? These plans, there's zero cost for your preventative care. So why did they delay their regular visit and checkup? I think that's we could dig into that. This is probably not the place for that, but I would say that there's some interesting reasons behind that I have seen in the past. 25% of the people surveyed still had not received the care that they needed at the time of the survey. 38% said their health got worse because they delayed care. Not surprising there at all. And then 17% said the treatment for the same condition became more expensive. So I waited, then I still had the same thing, but maybe because it got worse, now it's actually going to require a more expensive treatment. They on this particular survey, they have a bunch of different case studies, as it were, or stories, testimonials of people that had actually had situations where they couldn't afford things. One that kind of stood out to me was someone who put on here that they are an engineer. They're an engineer with a master's degree and have a very, very good job, but they actually had to take a job as a cashier at a pharmacy just so they could afford their medications. Just so they could afford their medications. So they have a chronic condition. They have a very good job, engineer with a master's degree on a very good health plan, could not afford their medications and had to take a second job just to afford those. That ain't right. Then, a couple of other things that they talked about here is 17% left their jobs because they got better health care somewhere else. That's pretty tough if you're an employer. But another big part of this is employees, whenever they looked at all the data, that employers on average lose about 6.3 hours per employee per week due to medical issues, due to the cost of delayed care. So this is a pretty big deal, folks. I believe that this study really opens up a lot of things that a lot of us have seen. But whenever you really look and dig into it, the fact that people are on health plans that the employer in many cases don't realize is having a negative impact. They think they've got the right thing going on, and it simply doesn't. There are some good options out there. So if you're an employer, you may not realize this is happening, but let me tell you, folks, you're having a pretty negative impact on your employees if you're not out there putting a true a health plan that has true impact on their health. You got to put health care into your health plan, or else they're just not going to get any. So just keep that in mind as we're going along here. All right. So the 2024 budget is out, and there are a few things that are in there that affect health care. There's a number of things, I guess, across the board that would affect healthcare. We're just going to hit on a few of those. One of those is that Medicare would be funded perpetually. Currently, that fund, that Medicare fund, was projected to run out in 2031. That's not too far away, right? We're talking about just a short period of time before that ran out of money. But the new proposal, once again, this is not a approved budget, but the new budget would put an additional Medicare tax on Americans making more than $400,000 a year that would help continue to fund that, so that it would not run out of money. And then, of course, that budget also continued. It moved forward the negotiations on medications and even increased the number of medications that can be negotiated by Medicare over the next few years. So that's another thing that it did. One of the more interesting, I think, fundings also that was in there was for Medicaid. And not just because it gave additional money to Medicaid, that's fine, but there are still 10 states that have not expanded Medicaid. And so what these additional monies would do would create a Medicaid-like coverage for people in those 10 states. Kind of an interesting deal right there. Being in Texas, where we do not have that expanded Medicaid, that would obviously affect us. There's no real definition of what that's going to look like, but it is in the proposal to in the 10 states. Once again, Texas being one of those that has not expanded Medicaid, a Medicaid-like coverage would be offered to individuals. A couple of the other things, money once again towards the opioid crisis, some maternal health and health equity, telehealth access. Now, the telehealth access they're talking about is increasing the infrastructure for internet so that more people would have quality internet so that they could receive telehealth services. A big one that, of course, is going on right now is cybersecurity. So looking at putting a lot of money in towards cybersecurity, a lot of education, and especially helping some of the hospitals to upgrade their cybersecurity so we don't have a reoccurrence of some of the things that are happening. We got the big Change Healthcare thing, which we'll do an update here in just a few minutes. But there's been a number of hospitals over the last year and a half that have also been impacted in a pretty serious way. So that's just a few of the things that are going on with the budget. So as things are kind of develop more, we'll keep you up to date on what's going on there. One of the interesting things that kind of brought to light what can happen in a situation where all of a sudden you have a battle between one of the large insurance companies and a big health system. The more these systems consolidate, the hospital systems and the healthcare systems, the more power they have. But quite honestly, it pales in comparison to the size of the insurance companies now. They have so much power because of how huge they are. And I think this battle between United Healthcare and Mount Sinai out of New York is just another example of that. We're looking at providers. I mean, everything's coming to a head this week, and we're looking at a number of residents in New York that may lose access to the providers as being in network. Now we know that especially if you're on some type of HMO plan, that means that you're not going to see them at all unless you're paying a lot of, paying fully out of pocket. And if you happen to be on a PPO network, then typically you're going to pay more. So what we're seeing across the board there is a lot of folks saying, "Hey, I'm losing my doctors. In essence, I'm losing them because I won't be able to move forward in this." Now, imagine if you're in some type of treatment. One of the folks that had some comments on this was, I'm losing my primary care doctor. I'm losing my specialist. I'm losing my physical therapist because I'm still in recovery from an accident. And so when you look at a situation like that, this is pretty dire. Now, the interesting part of this is, think about this. We're talking about March 22nd. So, end of this week is when all this could that's it. Your doctor's not in network anymore. Well, when you consider that for a second, this would have been much better information for these individuals to have, say, in October or November of last year. Now, while they did receive letters that this was possible, it was really put as, hey, just a heads up, not you need to change your plan. But when your plan goes from year to year, or whenever you cannot change your plan in the middle of the year, right? Because losing your provider is not a special enrollment period. When this happens, then you're just kind of stuck. There's nothing you can do to change plans now. But if you're in treatment for something and you cannot get that continuity of care because now you're out of network, what do you do? It really doesn't seem very fair or even make sense in many ways for you to be able to lose your access to your doctor that in good faith you sign back up with a plan expecting them to be there throughout the rest of the year. So these negotiations that are going on, because states do have the authority to stop these things from happening in the middle of the year, but it simply hasn't happened. So it'll be interesting to see if this is a tipping point. I mean, it's happened so many times, I doubt if it will be, but this one is pretty much in the limelight because of who it's affecting. And so I think it'll be very interesting going forward what happens in that. Now, another thing that is affecting this is because One Medical, Amazon, of course, owns One Medical now. And because they actually have a contract with Mount Sinai to use their agreements with insurers, then this could be affected too. People that are using One Medical can also lose their in network in this case as well. So very interesting. We'll keep an eye on this and kind of let you know what's going on. All right. So we're going to go ahead and give an update on what's going on with the Change Healthcare data breach. I'll tell you, the Hospital Association, the American Hospital Association, has been obviously very involved in this. They did a study of 1,000 hospitals between March 9th and March 12th and found out that 94% of hospitals have felt an impact from the attack, and more than half of those have been significant or serious impact on what has happened, on losing stuff. So 82% reported that they had a cash flow impact. 33% reported the impact of over half of their revenue. Okay, think about that. Half of your revenue impacted. So that's going to make services obviously not where they should be. 66% said it impacted revenue of 1 million or more. Let's see what else is important in this one. 74% said that it had a direct effect on patient care. So through no impact of your own, or through no, nothing that you could have done as a patient, all of a sudden you're impacted by this situation, and really the lack of response, of quick response for this. So, one of the things that I think is interesting is they were promoting that you should be doing workarounds, right? You should be changing your clearinghouse. Well, part of that survey, 67% said it's difficult or very difficult to change clearinghouses, and that 81% of the workarounds have only been somewhat successful. And then over 10% said that they were completely unsuccessful. So there's absolutely nothing that could be done there. This has been such a dramatic effect on our healthcare system that I think there's got to be some actions taken. Obviously, it was important enough that the White House even called the CEO of United Healthcare into, they say, hey, come on down to the White House. We got some questions for you. So who knows what happened behind those closed doors, but I think that it's obviously caught the attention of everybody whenever a CEO is called on the carpet, as it were, to come to the White House and discuss the situation and how they're responding to it. Now, another little side thing for this, I guess the best way to say it is I'm not the biggest fan of United Healthcare, but never leave it to them to not take advantage of a situation to help benefit themselves, right? So Optum has received a green light for an emergency purchase of an Oregon clinic that they have been pursuing for months now. That has really been pushed back on by a number of legislators in Oregon, and also a lot of the public they did not want this to happen. The Corvallis Clinic has been in some financial stress over the last year or so, but this has pushed it to the next level. So they 100% use Change Healthcare as the processing of their claims. So in essence, they had no more income coming in whatsoever. It stopped all of their cash flow. So because of that, Optum jumped in to save the day and said, "Hey, here we are. We've got you. If you'll go ahead and give us the emergency to make this purchase, we'll be able to save these guys." So Optum to the rescue, right? Well, just keep following us, and we'll keep you updated on all the other craziness that happens on this. But don't think it's over. There certainly is more to come on this. All right, and finally, last week we talked about how the Wegovy was now approved as a for cardiovascular events. Well, now Amazon and Eli Lilly, who makes Zepbound, a competitor to Wegovy, excuse me, has reached into a deal where you can actually receive your Zepbound for weight loss directly from Amazon. Eli Lilly has Lilly Direct, which is a program where you can talk to a doctor via a free telehealth call. You can go through the different things that you have going on, and then they will approve if it's right for you, I suppose. If it's the right form of treatment, you can get your Zepbound directly delivered to you from Amazon. So that doctor will write the prescription for you, and you're able to get it directly from there. So I think that's a very interesting thing that has happened, because it kind of gets your own personal doctor out of there. If you have decided that you want to do this and you want to take this medicine and you have the funding for it yourself, then you can kind of in round your doctor and go directly to Lilly Direct through the Amazon platform, and in essence get this medication if this doctor agrees that it's the right treatment for you. I kind of have mixed feelings about that, but I personally think that should be a decision that you make with your personal doctor. But as we have also seen, there's a number of people that don't go out and see their doctor regularly. So maybe at least this would give you a doctor to talk to find out if this is even something that you should be considering. So as these things become more and more open, and because as telemedicine becomes more mainstream, I think we're going to see more of these type situations. I think we're going to see more folks turn away from maybe their traditional doctor setting to try to influence a teledoc into giving them the medication that they want. Interestingly enough, I've heard a number of people say that they don't believe that the medications that are shown on TV make an impact on what people ask for. While overall, I agree with that. Certain medications, like what we've seen with these GLP-1s, they have had a pretty big impact. People learn about these from some pretty expensive ads that are out there, and we have seen a number of people kind of clamoring for them. There's no doubt that that folks hear also from friends and neighbors that have used them, friends, neighbors, family that have used these medications, and so they look to them that way as well. But this is having an impact without a doubt. All right, that's what we've got for you today. If anyone has any questions or comments, now is the time to put them out there. If you've already put them out there, then we will get to them here in just a second. One of the things I do want you guys to know is, hey, we do this for you. So if you like the way that we're presenting this, then let us know. If you don't like the way we're presenting this, let us know as well. I really am doing this because it's on my heart to present this to folks, to make it more easy to digest, to put it in layman's terms, because I'm not the most technical guy. I'm going to tell you kind of what my view is on it. So while this is kind of news, it's also kind of editorial. I know the difference between the two. So you're going to get my take on it. I'm going to be unapologetic about that. But if you want something different, then hey, let me know. I'll be happy. We changed it to this format because folks wanted to see it a little bit differently. So we are across multiple platforms, and we are providing the information and the insights based kind of on what my experience has given you. So do we have any comments or any questions today? Doesn't look like that we do, but I want you guys to know I do appreciate you taking time out of your day. If you're listening to this on a recording, please don't forget to put whatever comments that you have in we will follow this stream, in other words, and please leave your comments or your questions in the event afterwards, and we'll get to you as well and answer your questions. Once again, thank you everyone for being here. Everyone have an extremely blessed week, and we will catch you next time on the Kickstart. Couple of quick things to remind you of. Next Tuesday, the 26th, we will have our latest episode of Why Does Healthcare Suck? We're going to once again talk to some employers. We have some employers that have been successful in transitioning to alternative funded plans, and want you to hear about what they've done. We also are going to have some input from a very interesting young lady that has worked with a number of municipalities and cities, and she has seen things that they have done that have not worked. I think you're going to want to hear that as well, because those case studies in many cases are just as important as knowing what did work, so that you can avoid what happened there. So that is 11 o'clock Central Time next Tuesday, March the 26th. Why does healthcare suck? It is a live audio event on LinkedIn. So you guys be sure and check that out. And then you can always catch my variety of different guests on the Health and Wealth Power Hour. That is released every single week. If you want to see all the guests that I've had in the past and kind of peruse through at your own accord, then you can go out to hwpowerhour.com. If you want to learn more about what we do at Eagle Care, go out to eaglecare.com. Love to talk to you about the very innovative solutions that we offer to small businesses. We can also work with larger size businesses as well, but those small businesses are near and dear to our heart, and those who we have helped for a number of years. Love to talk to you about what we can do to help your business, or if you're a broker out there, how we can help you help your clients. All right, everyone, have a blessed week. Thanks for being on the Kickstart. We'll catch you next time. We are out of here.